So first, the radiology shortage. Anybody who is a clinical radiologist today knows that there's a shortage of physicians in general and radiologists in specific. It's not a problem that we're going to solve through training alone. So we do need technology to expand the capability of the radiology workforce. It doesn't just affect radiologists. It's a problem that we also have with technologists and other radiology support personnel. The global market for radiology has been growing steadily for decades. Uh, Probably averaged 6 to 8% CAGRs since the late 1970s. And the reason for this is simple. Medical imaging just keeps becoming more and more uh, capable of non-invasive diagnosis and minimally invasive therapy. If you think about it, when a patient goes to see their internist or other primary care physician, early most other physicians, the value proposition for the patient is the time spent with the doctor. And that's important. I like to spend time with my doctor too. But from a business viewpoint, it creates a real business model problem for medicine in general, because for doctors to get more efficient, they've got to reduce the amount of time that they spend with patients, and the reduction of that time inherently destroys the value proposition. The patient's there to spend time with you as a doctor. But when a patient goes to see a radiologist, it's actually quite different, right? Because the ideal episode for an MRI or a CT from the patient's viewpoint is the exam was painless, it took a minute, and the report was available a second later. They don't care whether they've met the radiologist or not. If the radiologist is not doing an interventional procedure, there may be some exceptions to that. Mammography, for example, I think patients do value getting an immediate result from and an explanation from the physician. And perhaps they would for other medical imaging procedures as well. But the bottom line is most radiologists, despite all the articles written about how radiologists should become more clinically involved in care, the trend in radiology is actually the opposite. The number of exams is increasing, the number of images per exam is increasing, the training is relatively flat, and the shortages just keep growing. So currently, I think there's something like 1,400 job postings at the ACR website for radiologists. Techs are in high demand. Hospitals are beginning to have to curtail services in their emergency rooms and other aspects. And even we have hospitals with threat of not being able to keep their doors open simply because they have insufficient staffing.